physicians are taught to think systematically. How does that prepare you for, not just recognizing what's broken, but how to wrap your mind around the steps and solutions that are going to be required to fix it?
Well, one of the things I think is super important is that physicians have to recognize the value they bring as they leave the clinical space and enter the entrepreneurial space. And so I'm a big fan to think about people, process, and only then technology to scale and sustain whatever the change is that you want to bring forward. I'm often brought companies to me, often by a tech wizard, super smart, had a personal problem. They saw their loved one get what they thought was maltreated. It just didn't work out well. And they bring a tech solution, but they don't understand the people and process that goes into how we deliver that care. And so the technology has to fit first into those two things, and only later can you build something around that. If you build tech first, it almost always fails. That systematically, you have to really understand how healthcare is deployed. And I think that's the value that physician entrepreneurs bring to the table, as opposed to the idea that I'm literally going to build that thing. Engineers do a much better job building that thing than I do. They, fortunately for them, have not suffered through medical school, residency, all the rest of it, to understand those people process issues.
It's because engineers are smarter than us, Alan. I come from a long line of them, but you hit the nail on the head that to me, we get the brainware. Right? We don't understand the hardware, we don't understand the software, but we get the brainware of clinical practice and what it takes to see a patient through a journey. And from a systematic thinking perspective, that it can be a crucial component to any early stage company that's trying to find, product market fit.
I've had a hard time explaining what the process is that a physician has that makes them successful in even non-healthcare related innovations. Actually, was explained to me by some of the engineers at Microsoft. It's like you treat engineering problem just like you're seeing a patient. So for us, if problem comes in, here, I have a hammer, I'll start looking for the nail. But you do it as if a patient's come in with headache. Now you see, is it stress headache? Does he have sinusitis? Let's try to give him, is it allergy season or not? I will go through this whole process. And the differential diagnosis we are going through, and we'll do some tests, we'll try some medication, give them something, and they'll come back and they still have the same problem. And we finally figure out, okay, fine, this is a migraine. And this is how you treat it, and we observe and titrate the treatment, and it doesn't end with one thing. There's a whole continuous process of taking care of the problem, improving it. And that's how engineering explained to me that I think about engineering problems that way. So I'm never satisfied with one answer. We improve it, if engineers are all satisfied, and I was like, no, but we haven't really gotten and completely solved this thing. Yeah, we've partially done it, but that's not what we were looking for. The problem is still not healthy, or problem is partially solved. And you try other things to get to it. I think that's what medicine teaches us, is this process of differential diagnosis and figuring out what is going on with the patient that other disciplines don't get to experience.